Dr. Gould, thank you for joining us. Why don't you begin by telling us about yourself and America's Frontline Doctors and what you hope to accomplish by coming to Washington?
Thank you. So I'm Simone Gould, and I'm a board-certified emergency physician seeing patients on the front line. And I was very upset that I wasn't able to give patients medication that I knew would help them. This had never happened before in my career. And I would be talking with my colleagues, and they were not quite as bothered. Some were, some weren't, but I was very bothered by it. And I started and I was also bothered by the fact that the government was intruding in a doctor's ability to help a patient. Because, you're just a doctor here or there at a hospital that feels this way, I started looking for other people on social media who felt the same way, and it turns out there's thousands of us. And we just all kind of got together.
And did you expect the reaction that you got?
So the press conference of the summit got a ton of reaction, right? That got 18 million views in 8 hours, but actually the summit itself was 7 hours, 6 to 7 hours of education, which was live streamed. In the middle of the day, we did a press conference. That press conference, which I said got 18 million views in 8 hours, was apparently the most viral video of all time, then got taken off of all social media platforms, YouTube, Facebook, Instagram, LinkedIn, and Twitter, all of them, which is unreal. So if you ask me if I expected that, absolutely not. Absolutely not. I don't know what to say to that. I thought I lived in America. You had a bunch of doctors, respectable people, scientists talking literally about science getting deplatformed. It's outrageous. Every single listener should be outraged. And by the way, classic liberals who marched at Berkeley demanding free speech, where are you? Where are you?
How would you describe the safety and effectiveness of hydroxychloroquine? Because right now it's being treated in the media like poison.
So if there's one thing your viewers need to take away from this podcast, hydroxychloroquine is amongst the safest medications on the planet. It's safer than Tylenol, it's safer than aspirin, and it's safer than Motrin. Let's put things in perspective. Tylenol toxicity is the #1 reason for liver transplants in our country. Motrin and aspirin are linked to GI bleeds. I see that every week. I have a patient in the ER with a GI bleed related to Motrin or aspirin. Chloroquine or hydroxychloroquine is much safer than that. In much of the world, it's over the counter and it's sold in the vitamin section. I have pictures from Indonesia, and I'm sad to say this, pictures from Iran, where it's sold over the counter. In other words, in most of the world, you have rights that Americans don't have. It's really terrible. Safety, no issue whatsoever. Another interesting thing about chloroquine or hydroxychloroquine? It's actually good for you. It lowers your sugar, glucose, and it lowers your lipid levels. It is outrageous that it's been portrayed as a dangerous drug. It's black is white and white is black these days.
And it's being limited in something like 44 states, and doctors are getting in trouble for prescribing it. What's going on?
Yeah, so 44 states passed some kind of restrictions, and I'd like to share with your viewers. Please go to my website. We'll put it up at the end. And the reason is I've gotten tens of thousands of emails. A lot of them are people wanting to know how they can get hydroxychloroquine. So we're not listening to the politicians, and we're listening to the doctors. It's good. But I'm going to be posting on my website the states that are more and less difficult and how you can find a doctor who's okay with it. I think that's a tremendous public service. So that will be out there soon. Again, we have restrictions on all prescription medications, right? They all have to be approved by the FDA. 44 states also implemented rules, in addition, only regarding hydroxychloroquine. Let's just take a pause. That's weird. That's weird. Have you ever covered a story like that? That's weird.
What do you think? Why is that? What's going on?
As the days go on, in the beginning, I really didn't speculate, but as the days go on and the evidence is more and more and more clear, it's very hard to put a benign motive on this. It works. I don't know what to say. The drug is completely safe and it works. The mechanism of action would indicate that it is likely to work. We've now shown it works, and we're still pouring hatred on this medicine, which is going to save thousands and thousands of lives. It's pretty hard to put a benign motive. I will say that you always have to look and see who benefits if hydroxychloroquine is knocked out. That's what I can say for sure. So who benefits? Remdesivir by Gilead would benefit, vaccines would benefit, and also politicians and leaders who are invested in keeping Americans in fear. Those are the 3 groups of people that benefit.
It was sad to hear you got let go from your position. Can you say anything about that? Was it because of your trip to Washington?
Well, that's for sure. I was told in a text that because I appeared in an embarrassing video, that they would have to let me go. Let's put this in context. I'm a board certified emergency physician. We are pretty hard to come by. You know, until 5 minutes ago, we were considered heroes, myself included. I've got a great reputation. I get along with all of my colleagues. I take good care of my patients. I'm here because I care about patients and I care about people. And suddenly they don't need me. I mean, it's ridiculous.
Are you still glad you went to Washington after the way everything turned out and what you had to go through? You paid a big price.
You know, I know that your viewers understand this when I say the path I'm walking is rewarding. This is what has to be done. I'd like my children, God willing, future grandchildren, my friends, relatives, and fellow patriots to live in a free America. This is a complete loss of our free speech. Is it worth it to me to defend free speech? Everything is worth it to me to defend free speech and liberty.
Excellent, thank you. And tell us where folks can go to find America's Frontline Doctors.
Our website, we're the America's Frontline Doctors. They actually took it down. Shame on Squarespace. They took it down for no reason. I did get the name back after about a week, but I don't have it up yet. So it's under AFLDS, America's Frontline Doctors Summit.com. Please go there. I really did this as a gift for the American people. Don't take my word for it. There's a white paper on there that runs through all of the science of it, and it's not at all boring. It reads a little bit like a murder mystery, like who did it, you know? And you will draw your own conclusions by all the evidence that's there.
Well,
AFLDS.com.
Dr. Simone Gold, thank you.